Today, we will be talking about Vivek H. Murthy and his effects on public health. Vivek currently serves as the U.S. Surgeon General and was also the U.S. Surgeon General previously. He started his journey by receiving an education with a Bachelor's of Arts in Biomedical Sciences from Harvard University. He then went on to Yale, where he got both an MD and an MBA with an emphasis in healthcare management. He became the co-founder and president of an organization called Visions, which is a nonprofit. This organization takes U.S.-based students and professionals, and they travel to India to educate youth and community leaders about the HIV/AIDS epidemic. Their goal is to be self-sustaining, and they have several branches in India. After his time there, he was also a founding member of the Swasthya Community Health Partnership. This was another rural Indian-based project where they trained local women as health educators and basic healthcare providers so that those communities could receive basic services. Later on in his career, he became the co-founder and president of the organization Doctors for America. This is a group that works to make the American medical system more equitable and accessible to all. It seeks to unite both medical students and doctors in making healthcare affordable. Gun violence prevention, expanding Medicare and Medicaid, defending reproductive rights, and decriminalizing substance abuse are just a few of the many issues they tackle at both the state and federal levels of legislation. Their motto is patience before politics, and his work in this group has been influential throughout America. He decided to leave his important work with Doctors for America when he was nominated by President Obama to be the 19th U.S. Surgeon General, and he was sworn in December of 2014. During this time, he published a U.S. Surgeon General report surrounding addiction and e-cigarettes. This helped to destigmatize addiction so that people could view it as more of a chronic condition rather than simply the result of poor individual choices. This helps more people to receive treatment, and it also helps spread awareness of the dangers of e-cigarette use in its early stages. After Donald Trump was elected president in 2016, Vivek Murthy was asked to step down in April of 2017. During this period, he moved to working with the NCAA, where he increased access to mental health services for athletes, and he also did similar work with the U.S. Olympic and Paralympic committees. After President Joe Biden was elected into office, Vivek Murthy was asked to return to the position of U.S. Surgeon General in March of 2021. With the pandemic still raging, he was instrumental in helping the president formulate his COVID response plan. This included educating the public on the newly developed COVID-19 vaccines and helping to stop the spread of misinformation that was very dangerous at this time. However, his main focus during his time as U.S. Surgeon General has been on the mental health of communities. The last 3 Surgeon General reports have been focused on connection, and the latest was titled The Epidemic of Loneliness and Isolation. As our country becomes more divided, his insistence that social determinants of health are essential to consider is broadening the traditional view of public health and inviting individuals to contribute to their community.